Free audio post-production by alphonic.com.
Welcome back to another podcast of Heal Without Harm. Today's podcast is going to be about dry needling. You might have heard a physical therapist or a chiropractor or someone else on social media mention dry needling, and I know your first reaction was probably something like, wait a minute, you want to stick a needle in me and just like poke around in the muscle? So today we're going to break down exactly what dry needling is, clear up some really common confusion, and help you figure out if it's something worth exploring, which honestly, I think it probably should be. We'll break it down into multiple segments. Don't get too bored with me here at the beginning with some background. It shouldn't take too long. This will be a short episode. So it's clinically been around since the 1980s, and it involves a solid filament needle poked into the skin and the muscle aimed directly at the myofascial trigger point. Fancy way of saying the trigger point is like a stubborn knot in the muscle that you can't release on your own. Poking on it with like a thumb or an elbow isn't working. Cupping's not working. Scraping's not working. Getting adjusted or your back popped isn't working. And so this needle most likely will. The needle targets these trigger points to help relieve pain, reduce muscle tension, and improve range of motion, whether you're just dealing with daily activities or sports performance. I've had it work with people on acute injuries, stuff that got hurt in the last couple of days or last couple of weeks. I've had it work on chronic type things, people who have had pain for months, years, and even decades. And I've even had it it's been a really big staple in working with people who have more of a stressed out presentation. So they're not lacking range of motion. They're not necessarily lacking strength, but these knots are there more from stress response. A lot of people often ask, why is the word dry at the beginning? Why is it called dry needling? And that's just because nothing's being injected and no medication is going in and there's no fluid getting taken out. We're not taking your blood. It's literally just a needle. There's no little tube down the middle, ultimately, that's pushing anything into you or taking anything out of you. The number one question we get after we mention dry needling to someone is, isn't it just acupuncture? And no, it's not acupuncture at all. We actually both use the same needle, so that's the only commonality, but they're entirely different principles. Acupuncture is rooted in traditional Chinese medicine, focuses on the balance of energy, sometimes called qi. The energy generally will flow through meridians to promote overall health. This is something I don't understand fully, but I know it's not what I'm doing when I poke you with a needle. And dry needling targets specific trigger points. There are some different ways to do what's called perineural dry needling. So people who have neurological type challenges or neurological deficits or nerve-like injuries, but most of the time it's going to be more trigger point based. And so we're poking the needles into trigger points within the muscles based on neurophysiology and modern anatomy, not traditional Chinese medicine. I don't think either one is right or better or wrong or anything like that. They're just different. A good analogy is both a scalpel and a kitchen are knife blades, but they're going to be used for very, very different purposes by different people and people with different training, ultimately. Other questions we get is, what should I expect? What does this feel like? Does it hurt, right? So the needles are super teeny tiny. They're flexible and they really don't cause much discomfort. Most of the time, you don't even feel the needle going in. It's a slight prick at most, nothing like giving blood or any other sort of like injection. Afterwards, people will feel tired or fatigued in that area. And the reason is one, I did just poke you with a needle, so there is some tiny little micro damage. But two, this muscle has been spasmed, cramped, or turned on and contracted for a matter of time, a long matter of time for that matter. And when we poke it with a needle, we give it permission to relax. It's almost like it's been in a workout mode for however long you've been having this pain, and I just gave it permission to relax, leading to a quite fatigued feeling after. Think about if I had you hold a can of soup, that's a pound. It's not even heavy, right? But I had you hold it with your elbow bent to 90 degrees for weeks or months or years, and then I was finally giving you permission to like set it down. You would expect your elbow and shoulder and bicep to be sore and tired. So that's what you can expect afterwards. A lot of the times we're looking for what's called a twitch response. This is when your pain may get reproduced. And so if I'm poking a muscle in the back of your shoulder, that is causing the pain in your shoulder. When I hit that right spot, that trigger point, and you get a twitch response, that muscle like twitches or cramps or spasms, it may reproduce the pain that you're coming in with, which is honestly very validating for a lot of people. They feel like, wow, no, yep, you hit the spot. That is my pain. And it's the first time they've had it truly reproduced by someone else, and they feel vindicated or validated that that the spot has been hit. Ultimately, that can be quite uncomfortable at times, depending on the level of pain that you came in with. But generally, each time you get dry needled, it's less and less intense and less painful. But I have seen a pretty good correlation to the higher pain you walk in with, generally the higher the pain response during, but the relief afterwards is pretty solid. There could be some soreness that lasts anywhere from 1 to 3 days after the dry needling. Sometimes people report longer. I have noticed a correlation that the older the individual and the less active the individual, the longer the soreness generally sticks around. The younger and the more fit or the more active the person is, the shorter that sticks around. You can also have a little bit of bruising at the site of dry needling. Usually that doesn't happen. I would say it seems like 10 to 15% of the time it does. It kind of just depends on whether or not we hit a little superficial capillary or vein in the area. And usually that'll be indicated right away. Like, hey, one little drop of blood came out. Let me hold some pressure on this and it may bruise up a little bit. Results can be gradual, but sometimes they can be pretty quick. Everybody's a little bit different. Just be patient and consistent with whatever the physical therapist or provider told you to do afterwards. Another question is, can I go and do my activity right after? Most of the time, yes. There's not really any contraindications on what you do after dry needling, as long as you're not feeling faint or anything like that. And a lot of people actually report that after they get done getting dry needled, they can go lift or run better because they have less pain. And so it can be actually quite almost performance enhancing in that matter. But make sure you're not getting dry needled the day before a marathon that you've never ran or anything wild like that. Make sure you're experienced with the dry needling and experienced with whatever activity you're trying to get back to right after. Another big question is, what all can it help with? And while many associate dry needling with muscle pain, its scope actually extends much wider. We can target muscles, tendons, ligaments, fascia, scars even. And it's also been used for conditions like chronic neck pain, headaches, sports injuries, and post-surgical stiffness. Research shows that dry needling is generally superior to no treatment for short-term pain reduction across multiple different body regions, and it can absolutely add value when combined with other PT interventions. Generally, I use it for heel pain, plantar fasciitis type stuff. We're generally working in the calf. We've used it right along the Achilles tendon as well. There's some other muscles in the back of the shin, so like shin splints. We've used it for patellar tendonitis or anterior knee pain, patellofemoral pain, quad tendonitis, quad pain, hamstring tendonitis, IT band symptoms, greater trochanteric bursitis, pretty much bursitis anywhere. We've used it. Any sort of glute tendinopathy or piriformis type syndrome, sciatica, it's quite helpful with. Any sort of low back pain, we've used it with. Going up into the upper body, rotator cuff tendonitis, bicep tendonitis. People will ask if it can help with labral tears, and I tell people we can't necessarily affect the labrum specifically, but usually most of the time the pain in the area is secondary to muscle issues, so we can definitely help with surrounding tissues. Elbow tendonitis, such as golfer's elbow and tennis elbow, it's been helpful for. Carpal tunnel syndrome, it's hugely helpful for. Neuritis type issues, so ulnar neuritis and other things along that channel. Chronic neck pain, suboccipital headaches, tension headaches, TMJ dysfunction. I'm probably leaving out some, but I mean, it can be helpful in a lot of different ways. It's generally not a standalone cure though, so you can't just get dry needled and walk out and be like, look, I'm all done. I tell people it's a huge shortcut ultimately. It's meant to be used alongside other treatments such as exercise or scraping or popping the joints or some soft tissue work like massage. It generally is the superior one when it comes to modalities, but it's definitely one piece of a big puzzle on decreasing pain and then building back strength and range of motion. It's not always appropriate for everyone. We definitely use it for a lot of people, though. People with any sort of severe needle phobia, like my wife of all people, definitely don't use it with them. If the person doesn't want to do it, of course, we don't do it. If there's lymphedema in the area, if certain autoimmune disorders, we won't work it with. Pregnancy is generally a contraindication, but there's a whole level of exceptions and things like that. So we'll say it's definitely a precaution. If you're on certain blood thinners, you should discuss it specifically with your provider and potentially your medical doctor before proceeding with it. And actually, this is new, I found out. So as of mid-2024, the APTA, so the American Physical Therapy Association, reports that all but 4 U.S. states allow physical therapists to perform dry needling, which is all but 4 of them, so 46 of them. Though most states require additional continuing education or demonstrated competency beyond entry-level PT training. So yeah, we had to go to, well, WSU now includes dry needling in part of their degree, but for the most part, most people have to go take courses after they graduate on learning how to do dry needling. So to wrap this all up, if you've not had dry needling and you're listening with some sort of pain, dry needling is probably something you could or should seek out. Seek out a physical therapist who can use it, because I will say a lot of the times it has been what gives us breakthrough pain relief to get to the exercises that truly solve the problem. There's times where people come see me and the results they've had with other PTs have been less than what they want. And when we implement dry needling, I may be doing very similar, if not the same thing as the PT that they've tried before. But when we added in the dry needling at the beginning to help break through pain or break the pain cycle, we finally started getting the results that they were looking for. Dry needling is not acupuncture. I just want to kind of recap some things. Dry needling is not acupuncture. Its main goal is to target trigger points using Western anatomy principles. So again, muscle spasm or trigger points or knots in the muscle. And it works best as part of a broader PT plan, not just by itself. I tell people it's no different than if all I did was pop your back and we got your pain to go down, but we never actually tried to solve the root cause or something like that. I could just keep you coming back and doing dry needling, but I'm going to generally help you build an exercise plan and a healthier lifestyle and ultimately encourage compound interest type of benefits with the dry needling and everything else that we're going to offer in a plan of care. If you're curious whether dry needling could help your specific situation, the best first step is just asking your physical therapist, asking your doctor, asking your chiropractor, whoever that may be. They can assess whether it's a good fit for you, and I would say most of the time it is. If you have any other questions, please reach out to me in any way you want. Email, DM on one of the social media sites, whatever it may be. But I do think dry needling would be very helpful for you, and I hope this episode clears up some questions. Other than that, I hope today you just learned a little bit more how to heal without harm. We'll see ya.
Free audio post-production by alphonic.com.